You have probably been doing your TRT wrong all this time. I'm going to show you how coming up. Hey guys, what's up? Dr. Rob here, 25-year clinical practice, American Academy of Anti-Aging Medicine. I wanted to do just a quick video on testosterone replacement therapy because this is another conversation that I have almost every day. There are a lot of guys on TRT and they're unfortunately getting really bad advice and bad protocols in terms of their schedule and their dosing. For some reason, the standard dosing recommendation is 200 milligrams a week. I don't know where this came from because it should be based on your blood work, and 200 milligrams a week is a excessive dose for most people. Now, it's hard to know this because when you inject 200 milligrams per week or even 100 milligrams every 3.5 days, your levels are going to spike and trough and spike and trough. So depending on what day you get your blood test, you don't really know what your actual levels were. So if you think about how testosterone is released in your body, it's not released every 3.5 days. Before you went on TRT, it was released every day. So why wouldn't you dose it that way? Well, because when you do your injections, they hurt like hell and you get sometimes a little welt or a little bump or you get a little hematoma and you get a bruise and you're like, why would I want to do that to myself every day? But that's just the thing. If you microdose, you don't have to, okay? So I'm going to show you right now. Now, my particular dose is I do 0.6 mLs a week, right? Which is 120 milligrams a week. That's the dose that gets me to where I need to be. That might seem like not enough to you, but trust me, that's probably enough for most people. But anyway, so to make the math easy, since I'm doing 0.6 mLs a week, that would equal 0.1 6 days a week. So how do I do that? Well, I start with what's called a Luer lock syringe. And you're probably familiar with these, but this is a Luer lock syringe. So it's a 1 ml syringe that has a tip on it that you can interchange the needle, right? You can twist on whatever needle you want. So this is a Luer lock syringe. So you would take this syringe, you would put on a nice fat, let's say 21 or 23 gauge needle, something like that. You would dip that into your testosterone and you would draw out whatever you need for the week. So for me, that's going to be 0.6. Now, because I need 0.6, I'm going to draw out 0.65, and I'll show you why in a second. If you were doing 1 ml, then you would draw out 1 ml plus 0.5 extra, and I'll show you why. Okay, so you draw out 0.65, so now you have 0.65. Now you put on this short, tiny little 31 gauge, and you're thinking, but there's no way that you're going to be able to push oil through a 31 gauge needle. Now, when you do this, you just rip off however many you need. So if you look at this, you'll see that this is 6 31 gauge needles. The reason why there's 2 missing is because I did one yesterday and then the second one is on here right now, right? But this lets me know that where I am in my 6-day schedule, so you don't even have to remember, okay? So now I'm ready to do today's injection. I'm gonna do it right here just to show you how easy it is and how long it takes and how painful it is. And because it's a 31 gauge needle, you can literally do it in your bicep. So you take this off. Now, remember I said 0.65? This is why. Because you need 0.5 to fill up the hub of the needle. So now that I put 0.5 in the hub of the needle, I am at exactly 0.6, which means now I'm going to go into here and then I'm going to go until I get to 0.5, which is right there. Then I'm going to pull out. Wow, look at all that gushing blood. That's really awful. Now I'm going to pull that 0.5 back out of the hub. I'm going to take this cap, put it on, twist it. That obviously goes in the garbage. Now what do? You remember the 6 for the week? I'm just going to pop open the next one. I'm going to twist this on. And now I'm ready for tomorrow. And I'm going to put this down. And now I know I have 4 left. And there's the 1 ready for tomorrow. Let's take another look at this. Wow, look at all that gushing blood. That really hurts so bad. Isn't that radically different from what you were taught and probably what you're currently doing? So like I said, if you take 1 ml a week, then easy math would be 20 units, 5 days a week. So you can do 20 units Monday through Friday, take the weekends off. But at least now you will have way more even blood levels. When you get your blood work done, it's more accurate. You will have a lower chance of side effects in terms of your hematocrit or your blood cell counts. You will have lower aromatization, which is the conversion of testosterone to estrogen. So you will have less need for taking an anti-aromatase like an anastrozole or something. And you will just feel better because your levels will be more even. So I hope you adopt this protocol because it really changed my life, honestly. Before I was jabbing into these big, glute and thigh and all this stuff because I was dumping all this oil, and I just go bicep, bicep, shoulder, shoulder, sometimes calf, calf, whatever. It doesn't matter because it's such a small amount. Any body part can take it. You don't have any soreness, no bruising. You still see I haven't wiped this. I haven't put a Band-Aid on it, nothing. So I hope you adopt this protocol, and I hope this helps. See you.